The fight for accessible overdose prevention tools has taken center stage in British Columbia, with experts, politicians, and advocates demanding a change. In a province grappling with a toxic drug crisis, the call for free nasal naloxone is gaining momentum. Chloe Goodison, a trainer at Naloxone, has witnessed the anxiety students face when learning to administer injectable naloxone. They express fears of shaking hands, forgetting steps, or doing something wrong, Goodison shares. Even with her extensive experience, she prefers the nasal spray, which is easier to use and administer. While nasal naloxone is freely available in some provinces, most residents of BC have to pay, with pharmacies charging upwards of $75 for a 2-dose box. It's worth the expense, Goodison asserts, emphasizing the ease of use and potential life-saving impact. The case for universal access. Politicians and experts are advocating for nasal naloxone to be freely accessible to all in BC, similar to other provinces. Donya Fast, an assistant professor at the University of British Columbia, believes that while injectable naloxone is vital for healthcare workers, the nasal spray is a more user-friendly option for the general public, especially young people. Having nasal naloxone universally available to young people, with knowledge of its use and impact, could be a critical step forward in saving lives, Fast explains. A pilot project with uncertain outcomes. In May 2024, BC launched a pilot program, purchasing 60,000 nasal naloxone kits at a cost of about $123.50 per kit. These kits were distributed to pharmacies across the province, targeting specific populations, including those in cold climates, youth, and indigenous people. However, the program expanded in July 2025 to include anyone at risk of an overdose, without additional kits being purchased. Health Minister Josie Osborne has stated that an evaluation of the pilot program, scheduled for completion this summer, is still being finalized. When pressed by CBC News in mid-November, she acknowledged the importance of nasal naloxone but did not commit to making it freely available. A call for action. Caroline McIntyre, an emergency physician whose daughter's fatal overdose sparked calls for accessible nasal naloxone, criticizes the pilot program for not reaching targeted populations, particularly young people, effectively. She highlights her ability to obtain free nasal naloxone at Vancouver pharmacies without meeting eligibility criteria. Student societies at the University of BC and the University of Victoria report not receiving any kits from the province, and a nasal naloxone kit installed at UVic Student Union building over the summer has since been used and not replaced. The government's purchase of nasal naloxone was a response to negative press. I believe they created the pilot project to delay committing to providing nasal naloxone to anyone who prefers it over the injectable, McIntyre says. While some pharmacies still offer free nasal naloxone, Donya Fast urges officials to act to make it more widely available. This is something we can do now. When?